Which laboratory test is most commonly used at the bedside to monitor heparin titration during ECMO? A. Prothrombin time, PT. B. Activated clotting time, ACT. C. D-dimer. D. Bleeding time. Answer: B. Activated clotting time, ACT. Explanation: the ACT provides rapid, bedside results, allowing for real-time adjustments to heparin infusions. While anti-XA levels are becoming more popular for accuracy, ACT remains a global standard for immediate monitoring. What is the phenomenon where a patient requires unusually high doses of heparin to achieve a therapeutic ACT? A. Heparin-induced thrombocytopenia, HIT. B. Antithrombin 3, ATIAI, deficiency. C. Von Willebrand disease. D. Resistance to warfarin. Answer: B. Antithrombin 3, ATIAI, deficiency. Explanation: heparin requires antithrombin 3 as a cofactor to work. In many ECMO patients, especially neonates or those with prolonged stays, ATIAI levels drop, making heparin ineffective until ATIAI is replaced via FFP or concentrates, oxygenation and gas exchange. In VV-ECMO, if the patient's PaCO2 is too high, which adjustment to the ECMO settings is most effective at lowering it? A. Increasing the pump flow, L/min. B. Increasing the sweep gas flow, L/min. C. Increasing the FiO2 of the sweep gas. D. Decreasing the RPMs. Answer: B. Increasing the sweep gas flow, L/min. Explanation: CO2 removal is primarily dependent on the sweep gas flow rate. Increasing the sweep creates a larger concentration gradient across the membrane, allowing more CO2 to diffuse out of the blood. What is the primary determinant of oxygenation, O2 delivery, in a patient on VV-ECMO? A. Sweep gas flow. B. Total blood flow rate, Q. C. The size of the venous reservoir. D. The patient's respiratory rate. Answer: B. Total blood flow rate, Q. Explanation: while sweep gas controls CO2, oxygenation in VV-ECMO is primarily limited by the blood flow rate. To get more O2 into the patient, you must pass more blood through the oxygenator per minute. North-South syndrome, Harlequin syndrome, is a complication specific to which type of ECMO? A. Femoral VA ECMO. B. IJ femoral VV ECMO. C. Central VA ECMO. D. Avalon dual-lumen VV ECMO. Answer: A. Femoral VA ECMO. Explanation: in peripheral VA ECMO, femoral cannulation, oxygenated blood travels retrograde up the aorta. If the heart recovers but the lungs are still sick, the heart pumps deoxygenated blood to the upper body, north, while the ECMO pumps oxygenated blood to the lower body, south. Which of the following is a negative pressure zone in the ECMO circuit? A. Between the pump head and the oxygenator. B. Between the oxygenator and the patient. C. Between the patient and the pump head, venous line. D. Inside the sweep gas chamber. Answer: C. Between the patient and the pump head, venous line. Explanation: the pump creates suction to pull blood from the patient. The tubing between the patient's vein and the pump head is under negative pressure, making it a high-risk area for air entry if there is a loose connection. If the premembrane pressure, pre, is 350 mm of mercury and the postmembrane pressure, post, is 300 mm of mercury, what is the transmembrane pressure, TMP? A. 650 mm of mercury. B. 50 mm of mercury. C. 1.16 mm of mercury. D. 325 mm of mercury. Answer: B. 50 mm of mercury. Explanation: TMP equals pre-post. A normal TMP is usually less than 50 mm of mercury. A significant rise, e.g., greater than 100 mm of mercury, suggests the oxygenator is becoming obstructed by clots. When calculating the flow factor or V/Q ratio in ECMO, what does a ratio of 1:1 generally imply? A. The patient is ready for decannulation. B. The blood flow is equal to the sweep gas flow. C. The patient is in cardiac arrest. D. Recirculation is at 100%. Answer: B. The blood flow is equal to the sweep gas flow. Explanation: a 1-to-1 ratio, e.g., 4 liters per minute blood flow to 4 liters per minute sweep flow, is a common starting point for adult ECMO management to balance gas exchange. During ECMO, a low venous pressure alarm, suction alarm, is most likely caused by A. Hypertension. B. Hypovolemia or patient kinking the cannula. C. The oxygenator failing. D. High sweep gas flow. Answer: B. Hypovolemia or patient kinking the cannula. Explanation: low venous pressure means the pump is struggling to find blood to pull. This is usually due to the patient being dry, hypovolemic, or a physical obstruction in the drainage line. What is the standard purpose of a bridge in an ECMO circuit? A. To allow for rapid weaning of the patient. B. To allow the circuit to remain circulating while the patient is temporarily clamped off. C. To increase the total volume of the prime. D. To filter out leukocytes. Answer: B. To allow the circuit to remain circulating while the patient is temporarily clamped off. Explanation: the bridge is a short segment of tubing connecting the arterial and venous limbs. It allows blood to bypass the patient and keep moving through the circuit during emergencies or when testing the patient's ability to tolerate being off support.